Welcome back. It's still Morning Rush on Metro Television. It's time for us to have an interesting conversation with Dr. Prince Osei from Medi, Moses, and today we are talking about cystitis. We are talking about cystitis. According to this, is cystitis. Hey,
no, it's a cystitis. Yes. Cystitis.
How did you say the first time? Cystitis.
Oh, I mean, if you watch it,
Doc, how are you doing?
I'm doing very well.
I think 2023 started and I'm now seeing you.
It's good
to see you. But I was watching you though. Oh. Yeah, I think you guys delve into a lot of things, which included women a lot, and it's very good. Today we are talking about cystitis.
Yep. Cystitis. And let me, before we get into it, but viewers can also send us their messages.
Okay.
Any questions that they've got to ask the doc about cystitis, as he will be explaining on the show, you can send that in 0553 000035, 0553 000035. So,
Doc, what is cystitis?
Okay, so cystitis basically means that infection of the bladder, the urinary bladder.
Okay.
Yes, so we have other forms of infections. I think we've talked about enteric fever, which is a form of infection, peptic ulcer disease, which an infection can cause, and cystitis, as I explained, is an infection of the urinary bladder. So we all know that the bladder is located at the lower abdomen, around your pelvic area. So infections, some bacteria can get involved there, and it can be inflamed, or there can be infections around it. So basically that is what cystitis is about,
And it's commonly in females.
Yes, but males can get it, but it's most common in female. And it's caused by a bacteria that is called E. coli. So the bacteria is called E. coli, and E. coli is mostly an intestinal bacteria. So it's a bacteria that is found within the intestinal tract. So we've been advising women most often to wipe after they poo from front to back. The reason being that when you
pee.
The reason being that when you do the opposite, you may introduce some bacteria within the GI tract into the urinary tract. And that is mostly what causes the cystitis. So if you get some infection from the GI tract into the urinary tract, then it means that you can get an infection within the urinary tract. So mind you, this is not a sexually transmitted infection. So even women who are not sexually active, even children can get cystitis. So
wow. And if I'm getting it right, and this one is, I'm putting out a disclaimer, viewers' discretion is advised. From the anus, what comes out from the anus? If you wipe the anus and you don't wipe from the back, and you wipe from the front, and bacteria from the back comes in front, as in from the anus to the vagina, you could get cystitis.
There are a lot of bacteria within the GI tract. That is what helps digest the food we eat. We call them probiotics, and E. coli is a form of them. So when you do the opposite from like the wiping thing, when you do the opposite, like from back to front, then it means that you introduce the bacteria into the urethra, which is mostly close to where the rectal area is, especially in women. So that is basically how cystitis, we get cystitis, but there could be other forms too. We've also been advising that we shouldn't keep urine for a very long time. So there are some people that when they feel pressed, they'll keep the urine especially around before they go and pee. Urine also contains some bacteria which shouldn't be there. That's why the body needs to get rid of it. So when the more you keep it there, there's the tendency that it can affect the bladder and the organs around it. There are some women that when they go to work, they wouldn't even use the washroom.
Can you blame us?
Can you blame us? For people like that, there are a lot of people.
Can you blame us?
But it's not a good practice to
it's
also
not a good
keep
practice,
it.
But sometimes the
environment
I
get
good.
it, but
and women are prone to
but keeping it too could cause another form of infection.
So we should rather go and use it and get the infection and add it.
Use
is a
well.
way to treat it. Yes,
Okay.
that's what there's. Use
Okay.
it well. Yeah, there is a way to treat the washroom.
Okay.
So urine in itself shouldn't be kept for so many hours.
Okay.
If you feel pressed, you have to go to the washroom and pee. Yeah.
Okay, so it is infection of the bladder. The bladder. I want you to give us, some more insights on what exactly the bladder does.
Okay.
And the reason why when it gets inflamed, then we have the cystitis.
Okay, so the bladder is what holds the urine. The kidneys produces the urine. It sieves the blood to take a waste product from the blood. Then it produces the urine. And there is a tube from the kidneys to the bladder. So when the kidneys produces the urine, it passes through the ureters. Then it comes into the bladder. Then the bladder stores the urine. The kidneys are like a sieve. So we have it, yes. So that is the bladder there.
Okay, so if we could just be paused so that,
so the kidneys on your left side, those are the kidneys, the bean-shaped organs, those are the kidneys.
Yeah.
And the tube that leads down from the kidneys, the ureters. So when the urine is produced, it passes through the ureters into the bladder for the bladder to store the urine. The bladder is like a balloon or a ball that keeps the urine, and when it's full, then you get the urge to go and urinate. The bladder is there so that as the kidney produces the urine, every minute the kidney produces the urine, but you can't be going to the washroom every minute. So there is something in the body that stores it, and that's the bladder. And when it gets full, then you get the urge to go and urinate. So basically that's what the bladder and what it does. And the females is below the womb. It's just below the womb. And in males too, it's around that same area. And with the male, the prostate surrounds the bladder, like at the down part. So from the bladder, there is another tube that leads, that small tube that leads there. In females, it passes through the urethra where they passes urine. In male, you see when you look at the tip of the penis, there is this hole there. That is what leads to there. That's why the urine passes through that area.
When you say inflamed, what does it mean?
Inflammation is an infection. It becomes big, sort of like you having an inflammation of the hand. Sometimes the hand can swell up, it can become hot, it can become reddish and all that. So those are the things, when something is inflamed, that is basically what it means. It means that there is an infection in there which is causing it to become big, become reddish, become hot. So those are some of the things when someone has an infection. So any form of infection has these three things: swelling, redness, and hotness of that area. So with the bladder, you don't really see the bladder, but sometimes some things can manifest for you to see that there is an infection in there. And basically what you see mostly is the urge to urinate. So when you have cystitis, you have the persistent urge, like a very strong urge to urinate. You feel like the bladder is full. You go to the washroom, just a little amount of urine will come out. But the urine that is coming is very burning. It burns a lot. Like it causes this strong burning sensation and a strong urge. As I mentioned earlier, the bladder, you can store urine in the bladder, but when you have cystitis, when a small amount of urine comes in the bladder, there is this strong urge to go to the washroom. You can't hold it. If you want to hold it, you may soil yourself. So within some few, and it's so embarrassing that you go to the washroom now, within about 20-30 minutes, you feel that same urge again to go to the washroom. But when you go, just a little amount of urine is what comes, and within some few minutes, you start having those symptoms all over again. So it's very disturbing. With
the inflammation that you spoke about, you said when the urine is coming, it burns.
Yes.
Burning as in within the vagina, you can feel the pain.
Yes.
Not as in the urine coming and maybe it's hot or something
No,
like
not the urine being hot. So the burning sensation,
you
feel it within the urine. As I said, there is an inflammation. When you have an inflammation of the hand and something touches it, you feel the pain. So the same way when the urine is coming out, because the bladder is inflamed, you start feeling those pains within the lower abdomen especially.
But how often do women come with this problem? Do we even recognize it? Do we even know that this is cystitis, nothing else, or what?
They always come to the hospital when the situation is out of hand, mostly, yeah. Because sometimes when you start having the symptoms, they will go to the pharmacy to get 1 or 2 drugs, and when it doesn't go, that is when they come to the hospital. And it's something that we don't encourage, because with infections, the symptoms are almost the same, so you wouldn't know which one you are having. Even people go to the extent of treating malaria when they have an infection because of the symptoms that it gives hot, you feel hot within your body, you feel the chills and all that. Yes. So you get all those symptoms, and you may think that in Ghana, when you start having these things, the first thing that comes to mind is malaria. And we go to the pharmacy to get these drugs. And it's not the best thing. It could be a cystitis or another form of infections that is going on. Yeah, so we advise that when you're having any of these things, come to Medmosis. Or even if you don't have it, you need to have a regular checkup to make sure that everything in the body is okay. Yeah.
Okay. So so that's how it will be diagnosed when they come to you, your outfit, and then they go on that. Now, how can it be treated?
Oh yes, cystitis, all forms of infections can completely be treated.
Okay.
The difficulty has been that there are so many resistance to most of the antibiotics on the market. Yeah, and that is where Medmosis comes in, because with these forms of resistance that most of the bacteria has, the E. coli is one of the bacteria that is very difficult to treat, because as I mentioned, it's part of the body, it's a useful bacteria within the body. So you taking an antibiotic to treat it means that you may be doing your body harm, because the body needs it in the GIT to digest food and all that. But when it finds its way into the urinary tract, that is when it starts giving all these symptoms. So there are so many resistance, as I mentioned, these common antibiotics that people use. And Medmosis have developed some antibiotics that is multi-drug resistant. Like the bacteria cannot be resistant to it because it has so many pathways. You know, every drug has this lock and key system, and it is what it uses to kill the bacteria. But when the drug, the bacteria develops that resistance to it, it means that when you take the drug, it wouldn't be able to fight it. Yeah. But with the herbal drugs that we have at Medmosis, it's a multi-drug resistance. So when one pathway is closed, there is another one. Yes, so it's able to treat it. And I always talk about Femacure X.
Femacure X.
Femacure X as for the female. Yeah. So if you're having any form of cystitis, UTIs, and you've used so many antibiotics and it's not working for you, Femacure X is definitely what you need to get, and you can get it from any pharmacy. Or if you are a man and you're having, unfortunately we don't have that for the men on the market, you need to come to Medmosis for it to be treated. And with men, one thing is when you have it, the tendency of it affecting the prostate is very high. Okay. So you can have something that we call prostatitis, which is infection of the prostate.
Prostate, okay.
Yes, so the prostatitis, yeah. So as we saw earlier, the bladder is closer to the prostate. So when there is an infection of the bladder, the tendency of it affecting the prostate is very high. Okay. So some men start having symptoms similar to an enlarged prostate, difficulty urinating, frequent urination, burning sensation on urination and all that. And sometimes they may think that they have prostate cancer and all that, but for all you know, it's just an infection of the prostate that can completely be treated when you come to Medmosis. Yeah, so those are some of the things. And another thing too is when you have the infection and it's not well treated, you can get something that we call pyelonephritis, which is an infection of the kidneys. Okay.
Infection of everywhere.
You know, the urinary tract, they are linked together. From the urethra to the bladder, to the ureters, to the kidneys. They are linked together. So anywhere that there is an infection, there's the tendency of it. It climbs up. Yes, it climbs up and it affects the kidney. And when it's affecting the kidney, what mostly you see is you start having pains in your flanks, because those are where the kidneys are. We call it renal angle tenderness. You feel pains within your flanks. So if you're having any of these symptoms, but you start seeing these pains within your flanks, either the left or the right, then it should tell you that probably the infection is climbing up there. And we know the importance of the kidney. We don't want to get it infected.
No pain, right? Sharp one.
Yeah, you know, when you once in a while, like, you get some
Yes,
yes.
The pain there.
Sometimes you get it and you feel like, oh, it will go, but it's best to get it checked. If you get it checked, then it's not a kidney infection or it's not something.
You can have your peace of mind.
It's always better to be in the known than to be wanting. Yeah, so you can come to Medmosis. Our head office is at Adenta Barrier. When you're from Medina to Ebri, when you get to Adenta Police Station, we're on your left. You can come there. It's a diagnostic center. You can walk in there to get your lab check. It's a herbal clinic, it's a prostate center, it's a dental clinic, and you can come there for all these facilities. Also, you can go to, if you are within Tema and Ashama, you can go to a J. Kojo behind the school for the deaf. We have another branch there. Kumasi, you can go to Ahinima Kokobin, we have a branch there. Accra Central, you can go to the AESL building close to the Ministry of Road and Highway, or you can pick our numbers that are shown on your screen and call us for any assistance that you may need. But as I said, Femacure X for all forms of female infections, hormonal issues and all that. Prostacure X capsules is there for prostate-related issue. Medi Plus,
yes.
That's why he's smiling.
Medi Plus and Afromosis.
You haven't even mentioned it. He's just
no,
smiling.
Those ones I know because they are for them.
Hey.
As you know, Femacure X, he knows.
Yes. I know Medi Plus.
First, I remember when we started the conversation, the Medi Plus. Now, you didn't really get that side.
No, but the thing is that I know.
Now you know.
It's good for the
Have
men.
you tried it?
Okay, so you are saying.
Dog, thank you very much.
Kumasi, you talk about Kumasi?
Yes, I never Kokobe.
Okay.
Yeah, you can.
He likes to
you have
go
some
to.
colleagues.
You see, he likes to go to Kumasi.
Okay.
There are things there.
Exactly.
On that note.
So when he gets to Kumasi, he will
you
purchase.
need the Medi Plus and the Afromosis.
Hey, what of you? Doctor, thank you so much for coming this morning. Always a pleasure having you on. As we talked about cystitis, please don't say cystitis anywhere. It's cystitis, please.